So our welcome and introduction by Tony Getting, our Deputy Health Officer of Public Health on Arundel County Department of Health. Tony, take it away. Can we ask everybody to be muted, to mute your mic? Can we ask everybody to be muted, to mute your mic? All right. We've got an echo here. For the last time, or at least for now, I'm really glad to say that, and we'll be introducing our new program manager for the Office of Health Equity and Racial Justice in just a moment. So excited to have new folks joining us, just really fantastic. And you'll get to know more about Karina in just a moment.
Let's go off the slides for a second. Can you turn off the slide? Feel for the camera shot. Can you turn off the slide? Feel for the camera shot. There we go. I want to introduce our new program manager for Health Equity and Racial Justice, Karina Limerick. I'm his doctor.
Can you all hear us?
Yes.
Okay. Is there an echo still?
No, much better.
All right.
All right. Thank you to our tech geniuses. So as I was saying, I want to introduce you to Karina Limerick, the seat to my left.
Hello.
Who is our new program manager for Health Equity and Racial Justice. She joined us, I think, about 3 weeks ago now at this point, give or take. She's had a long career in public health, spent many years in New Jersey, and we're really thrilled to have her. She has, as I mentioned, a strong background in public health, strong background in health equity, and understanding what it means to do that work, both at a programmatic level, but also at a level of how do we integrate that into all of the services, not that just we provide at the health department, but in our community as well. And so you'll obviously be seeing a lot more of her in the coming months and years. And so just very happy to have her join the team.
Thank you for the warm welcome. Thank you.
We'll have more to say later in this meeting. I'll dive into our COVID now. What we're seeing is pretty constant level of COVID in the community. We're at the COVID community level, which we've talked about before, which combines the case rate and hospitalizations, is at a low level right now. But we're obviously watching what's going to happen as we enter cold and flu season, right? It's the end of September. The weather just changed a few days ago. We know what that means. And so it's really important for folks to remember that COVID is still here. It's never going to go away. And so it's really a matter of how do we continue to remember that we have to just incorporate our COVID prevention strategies and incorporate them into our lives. And one of the key parts of that is the new vaccine, that new updated bivalent vaccine. And we've gotten a lot of questions about, do I need this booster shot? Do I not? What? This updated bivalent COVID booster is for everybody 12 and older. So, normally, I'm going to talk about flu for a second. Normally, right, y'all get your flu shot every year. That flu shot is updated every year to have the strains of the flu that are circulating. So whatever you got last year for your flu shot is just a little different this year when you get it. And it's been that way forever. That's what we're doing with the COVID shot. We're updating it. So this new bivalent booster, it has the Omicron variant in it. And we've been talking about that for almost a year now. Well, this updated booster has that. And what's going to happen in the future is it'll be updated again as needed. So really the best way to think about this is that this is your seasonal COVID vaccine. It's time to get it. And so what does that mean functionally? That means if you got either your primary vaccine or your last booster, and it's been 2 months since then, it's time to get your updated bivalent booster. And what that really means is that by the time we hit November, pretty much every single person who is 12 and older should be getting their updated booster shot. This is the new, when we talk about what's our new normal, this is one more step towards that new normal, getting your seasonal vaccine. And now that's going to be, so you get that provides you updated protection. And then, yes, have those tests ready. If you have symptoms, you or your family members, test them, continue that isolation. We do continue to isolate if you have symptoms and you are positive for COVID, so that we don't spread it to others, right? For those who have underlying health conditions or who are older, treatment is available as well. It's really important to take advantage of that as soon as you have, as soon as you're diagnosed with COVID, if you have those chronic health conditions or you're older, so you get treatment, avoid the severe manifestations of COVID, and of course masks. Masks are still useful. We get a lot of questions about, should I be masking, should I not? There's two pathways to think about that. One is, what's our community level of spread? And I just mentioned that at the top, that our community COVID level is at the low level. If that goes up, we will change our recommendations based on that level. Right now, because it's low, we don't recommend universal masking. But the second piece of that is that individuals have different conditions and different circumstances. The individuals should always feel free to mask as they choose fit when they're around others. So we will continue to share that information as the fall and the winter unfold. And that's where we are with COVID. There will be more updates, and we'll keep you posted on that. I didn't realize there was a slide. I wish I'd known that. But you got to see the live version of Karina, so there we go.
Well, greetings again, everyone. Thank you for joining today's Equity Forum. I come to you by way of New Jersey, and I am delighted to serve under the leadership of Health Officer Dr. Kalia Naraman and Deputy Health Officer Tony Gedden. I could not have joined a more committed and capable team here at the Office of Health Equity and Racial Justice. Although our office's light shines bright, with your support, our collective action shines the brightest. And so we know that we cannot advance health equity alone. And we are grateful for both your continued support and your efforts in service to our community here in Anne Arundel County. Featured today are some of the ways in which together we are engaging Anne Arundel County community members and addressing their various health needs. I'd like to firstly turn your attention to our Deputy Health Officer, who will provide an overview of monkeypox, and she'll also give some updates.
Thank you, Karina. So We're going to continue because monkeypox, while we feel like we might have been hearing about it for a while, we never know who's joining our call and who may not have heard some of these things, and it's still relatively new in the United States. So we want to make sure we're covering things that we might have covered in previous meetings, like signs and symptoms. So we're going to continue to cover these pieces for a little while until it becomes more routine, like COVID, where you all now know the signs and symptoms without us going through what it looks like. So initially, you may have kind of flu-like symptoms, fever, low energy, swollen lymph nodes, body aches, etc. And then you may get things that look like small pimples, and those pimples will kind of mature and change into what will look a little more like a blister. You may see them on your hands, your feet, your face. We're also seeing them on genitals and people's anal areas. To the next slide. If you do see that, please call your medical provider. How is monkeypox spread? We want to make sure folks still understand how this is spread. Monkeypox is not designated as a sexually transmitted disease, but it can be spread through sexual contact because you are so close, through intimate contact like kissing or sex, direct skin-to-skin contact with the rash or any lesions that someone might have, sharing household items, so like sheets or bath towels, and then prolonged respiratory secretion. So this is not, I think you all will recall, like with COVID, they say, what's a close contact and what actually signifies a close contact. Similar here with respiratory secretions, you have to have a prolonged exposure to that individual, and you're going to have to come into contact with the actual secretion. This isn't something that you're going to get walking past someone or coming into contact with someone really casually, and you're not going to get it touching objects like a doorknob or sharing something small like a pen with an individual. Next slide, please. So something that we have not shared in previous meetings, but given this is our health equity call, we wanted to start to share what we're seeing. So demographics for cases and our vaccination rates. And we want to really talk about vaccinations in particular, and then in the upcoming slides, we'll really get into a little bit more with our vaccines and what we're doing and what they are. But as far as cases are concerned, we're primarily seeing our cases in folks that are 30 to 39. We are still seeing cases mostly in men, right? 91% of our cases, 66% of those cases are identifying themselves as gay or bisexual. And we do see a disparity. So almost 50% of the cases are in non-Hispanic Black men, 23% of the cases are in non-Hispanic white men, and then about 20% of our cases are in Hispanic men. So when we think about the demographics of the county, that is disproportionately impacting our Hispanic and Black residents based on the proportions of the counties these demographics make up. And then what we're seeing on the inverse of that is our vaccination rate. We're not seeing those proportions of vaccinations happening in the demographics that are being most impacted by cases. So we are seeing about 34% of our vaccinations happening in that 30 to 39-year-old age range. We are seeing more of our vaccines happening in our white males. So looking at about 57% of our vaccines at this point being administered to white residents, about 19% to Black residents, and about 11% to our Hispanic residents. That is something that we want to change. That's the reason why we're highlighting it first on this call. We want to talk about how to get folks to come and get vaccinated. And so we really want to make sure that everybody understands how simple it is to get vaccinated in Anne Arundel County. What we've done as the health department to make sure that we are limiting as many barriers as possible to folks coming in to get vaccinated. Next slide, please. Okay. So a couple of things. There's a new resident. So initially, we really had a very limited amount of vaccines. So if you wanted to be vaccinated, you had to be a close contact, you had to be identified. That has changed. We want to make sure that folks know that if you identify yourself as being at risk for contracting monkeypox, that is really all you need to have to be vaccinated. There was a change in the CDC and the FDA allowing for a lower dose of the vaccine to be administered into your arm in a different way. And so that allowed us to really give out more vaccine because we're able to use a smaller dose. So that means more people can be vaccinated with the same number of vials. Is it still effective? Yes. Is it working? Yes. We're seeing fewer cases week by week in the county, which is fantastic. We want to continue to see the cases going down, but we want to make sure it's not gone. And I've heard that question, right? We're hearing less about monkeypox. Is it over? Is it gone? It's not. Cases are still circulating while they're going down, but we want to make sure that people are appropriately vaccinated. Next slide, please. We can go to, and this is really, I want to make sure we highlight this, where we're vaccinating. We are vaccinating at our health centers in Annapolis. We are vaccinating our health center in Glen Burnie. We are doing drive-through clinics in Glen Burnie at our Bay Meadow location. We are vaccinating at Tim Moyer in Annapolis. We are vaccinating at Louis Scott in South County. We are working on vaccinating at community clinics and partners. We're working to identify partners. If you are a partner that would like to work with us to have a community clinic, please let us know. You don't need to provide any particular proof to be eligible to be vaccinated. This is, again, self-identified. Appointments are recommended. And the big change here is in previous meetings, we come to you and said you have to pre-register. That no longer exists. If you go to our website, and it's listed here, you'll see it really at the top of our website. It'll say for monkeypox appointments, you can pick your location, your date, your time, just like scheduling for a COVID vaccine, and you will be in a clinic and you're registered. We've eliminated the pre-registration as an option for folks. You don't have to do that any longer. You can go right into a clinic and get registered. So we're trying to make it as simple as possible for folks to get vaccinated. There is no kind of hierarchy of who's more at risk that we're looking at. We have enough supply at this point that anyone who is interested in being vaccinated or who has identified themselves as high risk, either because of their own sexual behaviors or because of maybe someone that you live with and it's not you. We want to make sure that you understand that you are able to get vaccinated and that we're here to help. So monkeypox testing, the other thing that we want to highlight is beginning at the top of this week, today, we are offering testing, so please do give us a call if it's limited testing here at our health centers, but that is something that is new as of this week that we are open to testing. We have tested individuals in the past, but it's been more folks reaching out to us and trying to find ways to be tested. This is something that we are advertising as an option for residents who really need testing, or we'll put it out there that if you have a primary care provider or you're insured and you can go to an urgent care, those are really the best places to be tested. And they're the best because they're also going to rule out for other things, right? Maybe it's not monkeypox. You might have chickenpox, right? You might have poison ivy. They're going to rule out all of the other things. We are not necessarily a primary care provider. That's not what we do here at the health department. So we're going to test you for one thing, and we're going to be able to tell you, yes, we know that it's not monkeypox, but we want to make sure that you're getting the most comprehensive care possible. And so if you have other options because you're insured and we have a primary care provider, we want to make sure that you're going to those individuals to get other things ruled out and to be appropriately treated. We will make sure that we're connecting people to all of the right care and making sure that they're getting to the right places, but we do want to make sure that folks know to use those resources first, and that we are here for you if those are resources that are not available to you. We want to make sure that people know that. I think those are really the highlights, so please let folks know if there are people in your network that are looking to be vaccinated for monkeypox. We have lots of availability. The clinics are not full, and we welcome everyone who has identified themselves, even if it's occupational exposure, so your job exposes you to individuals who maybe have monkeypox. Healthcare workers, we've had things like who do spray tans for a living, right? That have been questionable monkeypox. Please let us know and somebody get back to me.
One of the questions in the chat is, how do you test for monkeypox? Is it a blood test?
It is not. So the testing that we do is if you have lesion or the actual bump. What would happen is that someone would have to test the lesion itself. I won't go into all the more detail for those who are a little more squeamish, but that's, you're looking to get fluid out of that lesion, and that's the way that we're testing to find out. So you really need that rash to then determine whether or not you have one. The way that the testing that we're performing at the health department.
Thank you. We certainly have time for perhaps one other question. Invite your questions at this time in regards to monkeypox before we move on to our next speaker. You can certainly input your question in the chat feature of the Zoom platform, or if you'd like to ask your question directly, we're more than happy to allow you to do so.
There is a question.
Oh, sure.
About COVID-19 vaccine. Do you have, in order to get the booster vaccine, you have to have the previous one?
So the question is, for the new booster, do you need to have previous ones? So the one thing, you have to have had the first 2 shots. If you haven't gotten the first 2 shots, you do need to get those first, and we can certainly do that as well. But you do not need to have had any other boosters to get this booster.
What's the difference between a booster and the first or the second dose?
Yeah, so the first one is to introduce that first vaccine-induced immunity. After that, the booster just refreshes your immunity. So actually, it's similar to what we do with the flu shot. For kids 9 and younger, they're actually supposed to get 2 flu shots for their first time, and then every year after that, one dose. So it's pretty common when we work with vaccines to have multiple doses for the first, and then single shots after that for booster.
Thank you so much for your questions. We will now invite Jessica Hunnell. She oversees recovery support for the Anne Arundel County Department of Health. We're excited to have her on today's forum to talk about National Recovery Awareness Month. Jessica, I'm turning over the attention to you.
Hi, everybody. Good afternoon. My name is Jessica Hunnell. I am the Special Program Coordinator for Peer Support within the Behavioral Health Department. I oversee the Peer Support program, and if you're not familiar with peer support, I will let you know that we are comprised of right now about 30 people with lived experience with mental health and or mental health diagnosis, people that identify as being in recovery from one or both. And we offer, and each person has a very diverse, unique pathway to their recovery. So we don't identify being in recovery as one way or another. We do ask that the peers honor their pathway, but also to get exposed and educated on the other pathways to recovery should they meet a participant that's not interested in their individual recovery. We do service all Anne Arundel County, any resident that's 12 and up. Let's see. So I didn't want to do a PowerPoint because I don't know, but I have one here I'm reading off of. But we are unique in the fact that we sometimes get confused with other roles in behavioral health or in the recovery community. So we're not sponsors, we're not counselors, we're not case managers, and we're not clergy people. We're simply people with lived experience that can empathize and help someone else navigate their own pathway and independence within recovery, whatever that means to them. And we definitely offer a lot of mentoring and support for people. We like to say we meet people where they're at. We just try not to leave them there. We have a saying within our office that if somebody calls the peer support line, that there's no call left behind, because we can understand how much courage that takes, that if someone just has a little bit of the want to enter the pathway to recovery, we're going to make sure that even if they're calling to report raccoons, we're going to make sure that they get to whatever part of the health department they need to be, but we make sure that we take the time to talk to everybody that calls that line. We definitely participate in a lot of community activities. We want to make sure that people know if they want to enter recovery, it doesn't have to be boring or exclusive. So on top of finding and navigating resources to help assist people in their recovery plans, we also want to offer them the support that, hey, did you know that there's this recovery baseball game going on this weekend? Do you want to come? Did you know that there's this golf tournament? Would you like to do that? Bowling, those kind of things, so that we're kind of breaking down the stigma of what being in recovery looks like. And I think we do a pretty good job at that. We definitely assist within, helping them set their recovery goals, but we want to make sure, again, that they're being independent in their recovery process. So I'm not going to necessarily, my plan or what I may consider a crisis might not be somebody else's crisis. So we'll meet you where they're at, and it changes, in the beginning, the recovery goal just might be to get on maintenance, get off maintenance, get out of tent city, get into a tent city. And we're just there to kind of be non-biased and help support that person with resources and access to those resources as much as possible. So we have a stockpile drive that the peers share. And, if people call from the community or another peer support specialist is working with a participant in the community, and they'll say, I got this person and they have this insurance, or they, speak this language, or they have children, we can kind of pinpoint the best way to help that person enter their road to recovery. We try to eliminate words that are, again, exclusive or affiliate us with one pathway to recovery. So, we try to stay away from words like sober or clean, because some of those can be touchy for some folks too. They might feel like, again, that they don't belong, but everybody's welcome to do it. And because everybody has a different pathway as far as the peer support specialists go, if someone calls and we can kind of match them up with the appropriate peer based on their need or where they're at. And we also have, like I said, we have designated youth peer support specialists that work within our clubhouses, one in Brooklyn and one in Annapolis. So we use that as a big resource to assist adolescents or young adults should they want to into recovery or start the recovery process. And again, our youth peers are people who entered recovery early. They have multiple stories about where they started and where they are now. And the truth of the matter is we're all always recovering. You're not ever recovered. I wish, but it's just a process of, like I said, becoming the best self for you, with that, whatever that means to you. We also navigate jobs and things like that, so that if we can help somebody, one of our huge resources is the workforce development group, but also canvassing areas. So if I'm doing outreach in Annapolis and I see that the ZIPS is hiring, I might go into ZIPS. I might say, hey, what are your qualifications for someone to work here? So that if I do go into a recovery home, or I have a participant that's saying, transportation's a barrier and they're living on West Street, I can say, well, that the ZIPS is hiring across the street and this is what you need. So I encourage you to apply. Here's the number. I'll meet you there if you want. We do some hand-holding, but there's a huge reward when the person does it for themselves, setting those small goals and achieving them and rebuilding that self-esteem. So basically, in summary, we are role models for recovery. We provide mentoring, coaching, and encouragement. We connect people to needed services and community supports. We help in the process of establishing new social networks that are supportive of recovery, and we advocate for the multiple pathways towards recovery. You can find a lot of information about us on the aacounty.health the health department's website. But if you're on Facebook, there's also a lot of cool stuff too, to follow the Anne Arundel County Health Department. I have our page bookmarked because a lot of times there's services that we offer within the Department of Health that we can really link people to that sometimes we don't think. Like, I know I've reached out to Raymond sometimes about, a participant that might need help that the Health Equity Office is offering. So it's really important that we're collaborative, not only as a department, but as a community, to best serve the needs of people with mental health and substance use diagnosis. And we also do a lot of preventative care too. So we have a huge harm reduction team, outreach team, that we can get you set up, that if you haven't used yet, but you're thinking about it, or, you haven't been able to go to see a psychiatrist or a doctor to get the diagnoses, we'll help support you and get you those resources as well. So that's a lot about peer support. That's why I didn't want to do a PowerPoint, because I just thought I left the meeting. But like I said, we are busy this month. September is Recovery Month. You'll often see the folks in behavioral health wearing purple shirts or green shirts. The purple is symbolic of Recovery Month, and the green is symbolic of mental health awareness. So yeah. And Raymond, should I do questions now or do videos first?
I would do the video and then close with the questions.
Okay, got it. Yep. All right, so I'm gonna try to do this. I kicked myself out of a few meetings trying to share screen, so be patient, please. So I wanted to share a couple videos that are up on the Facebook page of actual peer support specialists that are working within the peer support program, sharing a little bit about what recovery means to them. I don't have the, oh, yes, I do.
New way to live. The most
Can you hear it?
Yeah.
Okay.
recovery to me it's a new way of life. It's a new way to live. The most important thing it's given me is serenity, peace. For so many years I had demons were navigating me in places and situations that I shouldn't be in. And now I have a sense of peace that I wake up and I genuinely am excited to wake up. Like, I get to live on this earth another day. And it's amazing.
Okay, that was Ben. Ben is a peer support specialist at our Anne Arundel Medical Center. Hold on.
Recovery has given me the opportunity to speak up for myself, to advocate for myself, to advocate for other people. So for me, recovery means taking small steps in my personal life and encouraging others to take small steps to just live your best life, like to be the best Jessica that I can be every day.
And that's me. And this is Tykira. She is our youth peer, one of them.
Recovery gave me freedom. It gave me a chance to really see life in a different perspective. It's very rewarding. Like, now I see a future for myself, and I see all the things that I can do. So it just gives you the opportunity to really create your life.
Yeah, so so this month we also did we are still doing it, Show Us Your Sign. Again, you can find that on the Anne Arundel County Facebook page as well. And we had people do write signs of what recovery gave them. So I'll show you that too. Hold on. I'll make this-
But we're unable to see it on our side.
What did you say, Raymond?
We're unable to see it on our side.
Oh, you can't see it? Okay, hold on. Let's try one more time. Let me try to stop the share. Can you see it
We
now?
still wouldn't be able to see it.
Okay,
But what you can do is, you can share with me, and then I'll share with everybody on our follow-up mail out.
all right, great, sounds great. So, yeah, thanks. And I'll put our information if you want to learn more about peer support and what we do. And you contact our office or you can email us and we'll be happy to share with you more. Any questions?
Thank you so much, Jessica. We will move on to our next speaker. I do invite your questions, however. Please feel free to input them in the chat feature. You can also share your questions with us directly via email at healthequity@aacounty.org. At this time, I'd like to turn our attention over to Bishop Torres and his team. He is the pastor of the Hispanic Heritage Church, and recently they were very instrumental in holding the Hispanic Health Festival. Two of our team members here at the Office of Health Equity and Racial Justice joined, and so we're delighted to have Bishop Torres and his team to talk about not only the festival, but Hispanic Heritage Month, which concludes October 15th.
Thank you, Karina, and thank you, Dr. Rahman and Tony. It's a blessing and a great pleasure to be here with you. With me today is our chair, Maria Casasco, that spearheads our planification committee or planning committee, as well as Elizabeth Matias of Bray, which is the force behind all the health services that we've had this past weekend in our church. And of course, our esteemed brother, Carlos Camino, which is in charge of the volunteers and others, all the departments. Combined, our team, of course, also worked really hard to get all the vendors and the sponsors, meaning the nonprofits and the profits for this event. But before I pass the baton to Maria, I just want to say a few words on behalf of the Hispanic Heritage Month. It's a great opportunity that we have as immigrants, and I have been an immigrant for the last 42 years, of which 20 years I served in the military with the Air Force. But I'm still an immigrant. My entire family lives in Puerto Rico, except me. So I count it as a blessing and an opportunity for me to represent the Latino or Hispanic community, which, by the way, have been around since the birth of our country, actually. I'll give you an example. Texas, Arizona, and Baja California. We've had Mexicans always present. But now we count it also as an opportunity to allow ourselves to be known that Hispanics come in every color. We're white, we're black, we are orange, and we're also red. We can find Asians that speak fluent Spanish in South America. We can find Indians, like in Puerto Rico, we had Indians as well, the Taínos. I believe myself to be a mix of white, black, and Indian. By the look of my person, many people will not believe that, but my dad has African in him. My mom is European. And of course, like I mentioned, the Tainos were present. And if I do a DNA test, I probably will be all three of them. And proud of that. Now, I just received the last numbers, and I believe our esteemed county executive mentioned that 52,000 Latino Hispanics are now in the county. And that's just a drop in the bucket because we continue to expand ourselves. We tend to multiply very quickly. Myself, I'm one of 11 siblings. My wife is 15 in her family. So yes, we are here, and we are a race, ethnic group that are blessed to be a part of this wonderful county. I've always said it, and I will continue to say, I think we live in the best county in Maryland. Not to say that other counties are not up to par, but I believe that my time in the county, which has been since 1988, except for 3 years that I was not here, I was in Hawaii, I've always had the opportunity to be blessed, to find resources, and to be connected to agencies, organizations in the government that were always here and helping us. So Hispanic Heritage Month, September 15th through October 15th, an entire month of recognizing one specific ethnic group that is also an integral part of our county. So we thank you for that, and thank whoever thought of giving us this opportunity to celebrate 1 month out of the year. So with that, I will pass the baton to our esteemed chair. We have numbers that are amazing. Our Hispanic Health Festival was an incredible event all over. So Maria, if you are so kind.
Thank you, Pastor. The vision for the Hispanic Health Festival and resources is to impact the Hispanic Latino community in Anne Arundel County with the gift of health and the knowledge to access community resources. And this steering committee, the four of us, is taking this very seriously, because how can we give the gift of health to the Hispanic Latino community in our county? Well, one of the big resources is this Hispanic Health Festival, thanks to this guy, Carlos Camino, that 20 years ago he had the vision of planning a festival that started really very, very small in Annapolis, but then after a few years, it expanded to the county, and using the Heritage Community Church as the venue for this festival, we started offering this event every year with that gift of health, bringing the services from the health department, private doctors, and also the knowledge of resources, bringing nonprofit organizations or agencies from everywhere in the county for this one-day event that, again, started very small, and I'm happy to report that 2 days ago, we had 1,778 people. That includes the Consular Week, 1 day, Mexico, that day, 1,778 plus 246. And probably that number is around 2024. We added this year what was called the Consular Week, because the Consulate of Mexico came for 4 days to offer services to their connationals at the Heritage. And then we have the Consulate of El Salvador coming that Saturday, Consulate of Peru that Saturday, and the information table from the Consulate of Guatemala. Liz is going to talk about the services, but we want to thank the health department for being a partner so many years, and we hope that for many years to come. But as you can see, this is really important to have it because many people are telling us that they take this festival as the annual exam, health exam, which for us make us really very proud that we have the opportunity to offer this to the people. And also for the what we call the VIP invited, because we can show you guys that the people come to us, trust us, and on a Saturday morning, we come all together to have this fiesta, because this is a real fiesta. I noted this, and I don't know about, we haven't talked yet with the rest of the steering committee, but personally, for me, after 2 years that we couldn't do it because of this pandemic, it was a fiesta, it was a festival. Everybody was so happy that that came that day. And that's all that I have to say, but very happy that we can report these numbers, and pass it to you, Liz.
Thank you, Maria. As you have heard, we are very excited, and as being in charge of the health services that we provide, we all cooperate with each other, which is the wonderful. I call ourselves the four crazy of love, because we begin in January, all of this. But we were having doubts if people were going to show up or not. So we were like, how much we going to prepare, how we going to prepare, etc. But I am extremely excited to see that we have broken records in every sense. I cannot read all the services that we provide, but we provided 11 services, different services, and so far we had like 217 between COVID and flu shots. We had around 70 people that the Kidney Foundation have seen. We had Chase Brexton that have seen around 44 people. So also healthcare and the dental school. So what is the most important, and this is not the final number because I still waiting until probably Wednesday or Thursday. They promised us we're going to set up, but as an approaching, I couldn't believe this is 549 people have been seen and take something from the health related. I am not taking talking about just brochures. I'm talking about they've been in touch with hearing screenings, immunizations. We have behavioral health this year also, dental checkups, and CPR classes. So if these 549 people got something for themselves, and they are going to have follow-ups in the federally qualified health centers that are Total Healthcare or Chase Brexton, which makes us, myself as a health, dedicated to health, because I'm a health advocate, is that my vision is to see them more stronger with themselves, learning about health. But I know that I like community, because I know that we are taking a little bit of everybody's back. So we are trying to put people in the right path to understand what they have to take care of themselves. And if they take care of themselves, of course, they're going to take care of their own families.
And everything in Spanish. We had our inauguration in Spanish, and the county executive was superb, talking in Spanish to the audience. And again, the agencies that they didn't have knowledge in Spanish, we had interpreters all over the festival, and it was great.
Thank you very much. And now I pass on Carlos, because he's going to talk a little bit more about it.
Just a little bit. I just want to say, since the beginning in 2002, the health officers at that time, Frank Phillips, and until Dr. Nimes Kalanaraman, give you all the support. The health department is a huge component for the Hispanic Health Festival. Thank you, Dr. Nimes. Thank you, Tony. Thank you, Raymond, and your team, man. You're amazing. Yeah, and without you and without all your help, all the vendors and sponsors, and Bishop Jose Torres, Maria, and Elizabeth, we could be done. I mean, it's amazing work for the people. And thank you, everybody.
One last item that I have is that we had 9 presentations during the festival, carried out by one of the people that we have trained. And they did 9 presentations, 5 tobacco ones, and 4 cancer presentations. So that's another piece that Department of Health put up and helped us with, and we were ready to be able to actually pass the information to people that were in the hallways waiting to be seen in some of the services. Yes, and everything's in Spanish, which means obviously that a lot of folks came. We have an incredible amount of testimonials, but I will give you one basic one. A gentleman came on Tuesday to be seen by the Consulate of Mexico, and it was 2:27 because I was receiving everyone for the 4 days. And I asked him personally when I met him in the lobby, do you have an appointment? And he says, yes. And I said, what time? 2:30. I said, well, come on. The consulate was on the 2nd floor. And I walked to this man, and by the time we reached the consulate, it was 2:30. He came out of that location at 2:37 with a U.S. Mexican passport. Now, for a Mexican or any other nationalities to be able to attain the same service, if they go to their consulate in Washington, D.C., first of all, they have to give up one entire day of work. Second, the majority of them needs to take a taxi and pay an incredible amount of money just to get there. Thirdly, they will spend the entire day at their consulate, and they will come out by 4 p.m. with no passport. They will be told in 2 or 3 weeks you will get it. So what we did, I mean, to just one person, let's say, is an amazing act of kindness and service. And this is a good example of what happened throughout the entire day Saturday. How people got their vaccinations, how they got a checkup, a physical checkup, a dental, et cetera, et cetera. So thank you to all the participants, all the sponsors, all the vendors that were working with us hand in hand, but specifically, and thank you 1,000 times to the Department of Health. You guys are amazing. Thank you so much.
I want to add something. Why we have consulates, and we're talking about a health festival, because COVID has been very, very hard on the Hispanic Latino community, and many people died. The consulates are a very important component because when they have to send the bodies to their countries, and the majority of Hispanics or Latinos want to have their bodies sent to their countries, they need to have documents. And that is the reason that we have included the consulates, not only for what Bishop Torres mentioned, but also because of the need that happened because of the COVID. And that is an incredible asset. And the reason that we have a consular week is because for the last 2 years or so, consulates were very difficult or impossible to get appointments. And they decided they bring the whole equipment and the whole staff. You know what it means to offer to deliver a Mexican passport or wherever, and that is the reason that we have the consular week. Many people don't understand why we have that. That is the reason. Thank you, Mark.
Thank you, Maria. Yes, no, I was going to say, if anybody has questions of any kind, whether present or online.
Please, everybody who is in the meeting, take a chance to pass around this information, and we always looking for a sponsor for the festival.
I want to just thank you. And many of us in this room were there, from the health department were there on Saturday, and it was an amazing event. It was, like you said, it was good to be back there, because it has been a couple of years. It was 2019, right, was the
Yep.
last time we had that. So it was wonderful to be back there, and I remember I was talking to Mr. Torres, how many folks do you expect? He said 1,300, maybe 1,500, so if you went over 2,000 is, you know, it just demonstrates the need, and it's clear how much you love this, and so, well, not just year 21, but for many, many more years, we expect to see this. So thank you.
Thank you.
Thank you.
so much.
You. So at this time, if you do have a question, we invite your questions via the chat feature.
Pete Hill just said, awesome event.
Oh, wonderful. Thank you for that feedback. We're also happy to have your questions by email at healthequity@aacounty.org, which I believe was sent out to everyone. Well, thank you. I want to honor your time, and I'm mindful of the time. And so I do invite you to join us again next month on October 24th. We will be having another equity forum then. It occurs every fourth Monday in the month, and so we invite you to participate and join us as we continue discussing how to advance health equity in our county. Thank you to all of our speakers today. Appreciate your joining. Thank you, leadership, as well for joining this forum today.
Thank you.
Take care, everyone.
Have a great day. Bye.
Thank you.
You as well.
You too.